There is new evidence connecting mass shootings to negative mental health problems for Americans. This research shows the impact extends far beyond the survivors and the immediate community to a much broader population. The study funded by the CDC found a mental health crisis line, saw a big spike after Uvalde. Of course, nearly 1 in 5 adults has had a family member killed by a gun. Some of the details are not surprising in the study.
No, and joining us today is a psychiatrist, Dr. Eric French, to talk about the data. I was just thinking about how oftentimes we get that collective high almost universally by certain sporting events, certain things, moon landings that lift us all up. And these are the types of events that take us all down, it seems like. So, but not everyone goes the same route. So do studies help us understand the sameness of us as well as the differences within us, like how we respond, react?
Yeah, it certainly can. I think what it seeks to establish are some patterns that are more so germane across the board when we're talking about events like this. There obviously is a lot of nuance behind it, and so it can't be the end-all be-all in terms of where we take the information, but it's interesting to see what patterns are established.
When you think about it, I mean, it's really almost every other day. If you're in the news business, you can name one. Not everybody can, because people have frankly tuned it out. They just can't take it anymore. Right. Does it impact adults and children in different ways, I would assume?
I think it does, certainly, because you're worrying about different things. I think the take home, though, is although it's being processed in a different way between adult and child or adolescent, people start to change the way that they live their lives in terms of feeling much less comfortable being out and about when these things happen. So I think the result is the same, but how it's processed is, I'm sure, very different.
The people in near proximity to events like this, their impact can be shattering. The PTSD, within a family member or two, a link that brings you there. But I wonder, because we've been around since Columbine and the reaction to Columbine, Sandy Hook, certain events have really impacted people, but via social media and via maybe becoming a little calloused to these events, I think we've all changed the way they impact us. And are we gravitating in a more healthy or a less healthy way of trying to manage these types of things like a mass shooting?
Yeah, I don't know that we can talk about this in terms of healthy versus unhealthy. Obviously, there's elements of that, but I think what happens is, as you were said, people are developing calluses where they probably shouldn't be. Like, these are terrible events, but when you get used to seeing it and you're hearing about it, as you were saying, every other day in the news, the shock value goes away, I think. But it's unfortunate to see that this is becoming so frequent that people are like, okay, again.
We used to talk about it with kids in video games, desensitization, and now it's in real life. This is not a video game. This is our lives.
Right, exactly, and that's where you see people changing their behaviors. Particularly parents feeling comfortable letting their kids go out and do things like going to the mall or various places, or even struggling with letting their kids go to school. And then kids sort of selecting their behaviors differently based on, as you said, when these things hit close to home, everybody sits up straight and knows somebody who was involved in this, and it really rattles people's cages.
Have we learned healthier choices, healthier ways?
Yeah, how do you manage it?
Start to, process or live with these things? Because it doesn't seem like they're about to stop.
Exactly. Yeah, and I think the healthiest way to work through things like this is to talk and particularly as it relates to informing our kids, letting them know that, a developing sense of situational awareness is important, and making sure that they understand the sequence and that these things happen. But, I think I'm always left wondering, how often this is going to happen, and does this continue to escalate? And if so, how does that impact us socially? I don't know.
Yeah, I don't know if these studies answer those questions for us. But like we talked about, maybe there's a metric there that helps us to some regard at least recognize how we are changing. It's good to see you again.
Likewise.
Dr. Eric French, thanks for coming in.
Appreciate you. Thank you.